Hello everyone, my name is David Feigenbaum and this is my BME 5950 project presentation. So I wanted to talk to you guys today about hip implants and medical device recalls, and then kind of go into some case studies as well as a discussion question afterwards. So this is pretty much the content of the presentation. First I'm going to talk to you about reasons to get implant, different kinds of hip implants, and we'll talk a little bit about medical devices, and yeah, so on and so forth, and let's begin. So first, some background on hip implants. The main reason to get a hip implant is from pain due to osteoarthritis. And for those of you who don't know, osteoarthritis is a disease that pretty much wears away at the articular cartilage that lines your joint. For those of you who aren't familiar with hip anatomy or really any joint anatomy, articular cartilage pretty much lines the bone, both ends of the bone, and they rub against each other to provide a smooth, low friction surface. So while you walk, there's no pain. However, as this wears away, you kind of have bone on bone rubbing against each other, and this can be incredibly painful. Here's a short YouTube video that I will post in the comments section. If you're still a little unfamiliar about the anatomy or just want to learn more, I definitely recommend it. It's a pretty good short YouTube video, but for the sake of this presentation, I'm not going to go over it, and instead we'll just move on to different kinds of implants. So there are various types of implants, various types of materials. You can have metal, you can have ceramic, and you can have plastic. Those are the main three implant materials, all involved in making hip implants, and then you can have like a mix and match of those. So here I have MOM, which stands for metal on metal, COC, ceramic on ceramic, and MOP is metal on plastic. And you can kind of see in the picture on the right, we have a metal on plastic implant. We have the acetabular shell on the top, and then we have, which is metal, and then the polyethylene liner, that's the plastic, and then the femoral head, which is also metal. So we have like a metal on polyethylene and kind of on metal hip implant, and this is kind of one of the more favorable hip implants to get. And now moving on, I want to discuss briefly the main problem with a metal on metal hip implant. For those of you who have read my report, I go over the strengths and weaknesses of each of these implants, but I just really wanted to focus on the metal on metal since it's such a big issue. The metal will actually wear away. Some particles wear off the metal as you rub the as you rub the femoral head and the acetabular shell together. Some of the metal debris can wear away, and this metal being stuck inside the body, this can be a huge problem, can cause severe pain, even inflammation, and obviously who wants metal inside their body? And to go a little bit further on that, I have a short YouTube video about this, and that kind of goes in with a case study. So if you guys haven't seen this video, let's check it out.
Barry Mang needed a new hip in 2004 at age 45. He did his homework and opted for a metal-on-metal joint replacement.
It sounded like a brilliant idea. From all the research that I did, it seemed like the way to go. It never occurred to me that having metal in my body would be a bad thing.
Within 6 months of his new joint, Barry's hip pain was back.
I thought something was going wrong. And I could tell, and I knew it was the same type of pain, the same area. So kind of a ache, a real deep ache. It's occasional sharp pains, but it's just like a bruise might feel, a really bad bruise.
Orthopedic surgeon James Crutcher performed Barry's revision surgery and replaced his failing left hip implant. He had no connection to Barry's first surgery.
The basic problem is that the metal bearing is shedding small particulates of metal, and we don't know if we're just seeing the tip of the iceberg. We probably are going to see a lot more than we've seen to date.
Ball and socket joints made of cobalt and chromium were supposed to last longer and offer more stability. But now, patients like Barry are reporting soft tissue and bone damage from metal debris.
It was frightening, is what it was. It was a full 2 years, which left me with a year and a half of thinking, I've got metal in my body, I got to get it out.
The best option would be to have a conventional hip replacement with titanium implants and a ceramic on highly cross-linked polyethylene bearing. This bearing that you see here is probably the lowest wear bearing that we have available today, and it has an excellent clinical track record.
Which is what Barry now has, allowing him to get back to work and do his job at the butcher shop. In Seattle, this is Mark Christopher.
So I wanted to show that video to you guys because metal-on-metal hip implants is such a big topic in terms of medical device recalls, because a while ago companies put these devices into people, and several years later, even today still, problems are arising, and it's a huge issue. A lot of companies put these devices in people and they're all getting recalled, and unfortunately they're all suffering a lot of lawsuits because of this. So if you're interested in reviewing that video again or watching the first video that I mentioned, the links to both of them can be found in the comments of this podcast. Great, so now moving on, I want to talk to you guys about medical device recalls, and the first thing to do is to define what it is. So according to the FDA, a recall is a method of removing or correcting products that are in violation of laws administered by the Food and Drug Administration. So I wanted to emphasize removing and correcting because in my head, before this project, a recall was just removing a device from the market, but that's not necessarily what it means. You could also, while the device is still out there, make corrections to it, make adjustments, do anything you need to pretty much reverse the recall, and then you can continue selling your products and making sure it does what it needs to do. Now going into the different types of recalls, there are two types of recalls. You have voluntary and mandatory, and they're pretty self-explanatory. A voluntary recall is when the company or firm or even manufacturer initiates the recall. And mandatory is when the FDA kind of forces you pretty much to recall your device. Just a quick note, mandatory recalls are really rare. They don't really happen that often. More of the time you'll see companies initiate their own recall. And similar to medical devices, recalls also have classes to them. There's class 1, 2, and 3. Contrary though, the classes are kind of reversed. So a class 1 medical device recall, it is kind of the riskiest. It's for the high risk or high harm to the patient. So for example, if a pacemaker wasn't really sending the electrical signals properly, then that would be a class 1 recall because that could mean fatality for the patient. And then class 2 is kind of medium risk, and class 3 is really no risk or harm to the patient. And then some of the other factors that are involved in recall are the depth of the recall, kind of how far do you want this recall to go? Do you want it to go to the consumer level, the retail or the wholesale level? Pretty much to what depth, more or less. It's pretty easy to say from the name, do you want this recall to go? And going off of that tied closely is the public warning. Who do you want to alert about this recall? Do you want to alert the general public or just specified persons? And what I mean by specified persons could possibly be, let's say you want to focus just on the surgeons implanting the device. You notify them about the recall, or again, you can notify the public or possibly another specific set of a group of people. And then lastly, the effectiveness checks. This pretty much describes kind of the percentage of the population that you want to check up with to make sure that they were notified about the recall. So there are 5 levels, A through E. Here they are on the right, and they're kind of self-explanatory. Level A, you notify everyone. Level B is a little weird in my opinion. I feel like there should be more levels just because this is such a wide range, and it's very case by case, obviously, because it's such a huge range. My personal opinion, I feel like it should be split up. But anyway, level B is when you notify either above 10 to 99% of the people. Level C is 10% and under, level D is 2% or under, and level E is you do not follow up with anyone, whether or not they heard about the recall. And that's pretty much the quick overview I wanted to give on medical device recalls. If you guys are interested on this topic more, I highly suggest going to the FDA website and doing a bit of research on your own. Or if you want a quick sum up, you can read the report I wrote on medical device recalls, and I think it gives a pretty good summary of everything I covered on this slide. Yeah, and with that, I think this is a perfect segue into our first case study. So for those of you who have actually read the paper, I'm sorry this is a little bit repetitive, but I'm going to be talking now about the Zimmer Durham cup. Sorry. So as you can see, this cup is actually a metal-on-metal hip implant, but weirdly enough, the recall that I'm going to be discussing right now is not because of the fact it was metal-on-metal. Rather, it was due to incorrect instructions that were included with the implant. For those of you who don't know, instructions are actually included with hip implants to kind of help surgeons better implant the device, quote unquote. The instructions pretty much cover where to make the incisions, how much bone to cut away, what angle to make the cuts at, things like that. And that's pretty much a quick overview of what the instructions go over. So that is why they were recalled, because the instructions that were included with this product were not correct. This was a voluntary recall, and just to give you guys a quantitative number, there were about 19,000 devices currently on the market at the time of this recall. So before I reveal the answer, I wanted to ask you guys, what recall class do you think this would fall under? Again, there are 3 classes, class 1, 2, and 3. Class 1 is the most severe. And yeah, take a moment to think about it. Which class would you pick? So if you guys need more time to think about it, I suggest to pause the video now because I'm about to reveal the answer. This was actually a class 2 recall, and when I first read this, I was a little confused. I thought this was ridiculous. Why does a simple set of instructions being wrong mean that this is a class 2 recall? I feel this should be a class 3. But what I failed to originally see was that if the surgeon had already implanted the device, this could be much more severe than I thought. Again, as I said, the instructions kind of include different cuts to make, different angles, how much bone to cut away, and especially this implant in particular, how much bone to cut away is incredibly important. If you guys can see, let's see if I can get my mouse. Alright, yeah, so if you guys look at this kind of hole right here, that actually fits right over the femoral head, and obviously you have to cut some bone away so that can fit over, but the more bone you cut away, the softer that bone becomes. And if you're just impacting, with all the walking you do, you're putting a lot of force on that soft bone, it might not be able to handle it. This implant could fail earlier than it's supposed to, which is why this is a class 2 recall. And after realizing that, I'm like, oh, okay, you know what, this actually makes perfect sense. This would be a class 2 recall. And I think that is all I have on this first case study. So now let's move on to our next case study, which is the femoral hip stem. Now this is a very interesting femoral hip stem because it was created by Cornell. Woo! Yeah, the BME Masters of Engineering students one boring Saturday afternoon got together and created this hip stem and brought it onto the market. And go us, because we're super smart. But unfortunately, there was an issue with some of the packaging. Some of the stems were placed in packages that weren't labeled correctly, and we had to issue a voluntary recall. So this is a very discussion-based case study. I'm going to pose you guys some questions, and in the comment section of this podcast, I want you guys to try and answer those questions. Sorry. So the first question I have for you guys is, what class recall do you think this is? Would it be 1, 2, or 3? And before you answer that question, I want you to think about this point. Does it depend on when we started selling the product versus when the recall was initiated? So does it depend on if we started selling in the fall and the recall was in the spring, or if we started selling in the fall and the recall was a week after we started selling? Does that make a difference at all? It's just something to think about, and I'm a little curious to myself as whether you guys think it makes a difference or not. And some other factors I want you guys to answer are, what was the depth of the recall would be. Would you alert the general public or not, or just specified persons, possibly the surgeons who bought our device? And lastly, what effectiveness check level would you decide? Remember, there are 5 levels, and if you do decide on B, please be a little bit more specific. It's a big range. It's 10 to 99%. So if you pick B, please list the percent and list a reason why. I feel like that's just kind of, oh, let's just pick B. It's an easy one, but give me your actual percent number and list a reason. So yeah, that's this case study. This is a very discussion-based case study, and I'm really excited for your guys' answers. And I'm going to respond to those answers because I like the little debates. And lastly, to top this all off, I want to pose a discussion question for you guys. I know this is a very discussion-based presentation, but since my report was very factual, was more of it meant as a mini tutorial / case study report, I wanted my presentation to be much more discussion-based. So my discussion question for you guys is based on substantial equivalence. It's a good way to bring new hip implants onto the market. Just finding old hip implant, comparing your new design and being, yeah, it's super similar, ours should get on the market. So my question for you is, what if the model that you were used to use substantial equivalency for, what if that had to undergo a recall? Does that mean that the new device that we brought onto the market should be recalled as well? And quick short answer for this, if a big points if you guys can predict my short answer, but it depends. What a shocker, I know. It really does depend. It depends mainly on what kind of recall this was. For example, if this was a packaging recall like we saw earlier with our Cornell implant, then does it really need to be? Does our new design really need to be recalled? I don't know. That's why this is a discussion question. Or what if the recall was more of a design flaw? Do you think then that our new design should be recalled as well? These are all perfect points of discussion, and I'm greatly looking forward to hearing your guys' answers. And yeah, that's really it for my discussion topics of this presentation. I hope you guys enjoyed. I hope you guys learned a little something about hip implants and medical devices. If you guys have any questions on anything I presented, please feel free to comment and I'll answer them as quickly as I can. But again, just remember to post your answers to my second case study as well as the discussion question. I'm really looking forward to reading those and responding, and hopefully we can get a good debate going on. But again, thank you guys, and I hope you enjoyed.